as well as the healthcare professionals out there. And our journey is in the hospitals as well as outside the hospitals.
Okay,
yes.
You are providing the resources,
yes,
the necessary equipment, and where possible, perhaps expertise and counsel as to what to be done within this health sector.
Yes.
Thank you so much. Let's talk about the month of this month that we have dedicated this month to women. We're celebrating women, but we are celebrating people that there's no equilibrium, there's no balance when it comes to access to health and women's health equity, particularly in breast cancer and cervical cancer. How serious is this issue?
You see, this problem is not only for Africa. It's a global healthcare program. And when you look at it, you'll realize that generally women have a huge barriers, a lot of challenges in order for them to be able to access, better patient services. And you realize that sometimes when it comes to issues of timely diagnosis, as well as provision of treatment, it becomes a huge problem when you look at our landscape, or maybe as well as the middle to low income countries. So it's a huge burden looking at the fact that we have close to about 2 million cases annually, as
globally.
Well as this will be globally for both breast cancer as well as cervical cancer.
Okay.
Yes.
Let's talk about early detection. Can it increase your chances of survival?
Early detection allows or maybe triggers early treatment. So basically this goes across a spectrum of all diseases. Okay. This allows the healthcare professionals to be able to intervene, and it becomes more or less costly as well as cure. So that now ultimately promotes what we call survival rates. So the earlier you are able to detect, the more you are able to intervene as well as be able to assist the patients. So what needs to happen now is on areas like that, we need to be able to strengthen our primary health care setting so that we can be able to achieve what we call universal health coverage. And universal health coverage, the core under it is what we call detection or accessibility, engagement of the communities.
I don't know. Let's you see, the issue of cancer is something that has impacted me as well, as your news anchor here. Having lost a sister to breast cancer, 2016, 3 months after marriage, and the one who came before her now is still, she's a fighter. She's fighting that. Let's talk about the issue of early detection. Both of them, the cancer was detected stage 3, stage 4.
Yes.
When is the early detection? When are you able to say, I think whatever I'm going through, this could be cancer, I should go for testing? Because I know the other one kept on going and then there was no detection until at a later stage she was told, this is now stage 4.
Yes. So
do we have capacity to say, okay, you've gone, there are early signs, this could be cancer or this is cancer, now we nip it in the bud, we're going to treat you. Or now you have this pain in your belly, you keep on going, they perform the test, they say, no, we don't see anything, there's nothing. And then when now the problem has exacerbated, you come in, you're told stage 3, you're told stage 4. Do we have that capacity, effective, the early diagnostic methods or equipment available in this country?
You see, when it comes to prevention, that is very critical. So prevention is one of the first things that we need to be able to do. And diagnosis now, we get into say we have a chance of being able to detect or we are able to diagnose a cancer here. So in Botswana landscape, you realize that we have MRI, we have mammography. However, some of these methods are very expensive. And you realize that in certain places, not everyone is able to access this. Unless maybe you have medical aid, that's when perhaps maybe you can be able to have an access to this. This would be in the private setting.
Okay.
But we also have the laboratory or diagnostic methods. This is now on the laboratory diagnostic methods. We have things like what we call HPV DNA test, which when it is done at an earlier time, it gives you the likelihood or the space to be able to say there are chances of detecting cancer. And when it's like that, it helps in terms of trying to cure. It helps in terms of what medication we are able to work on. Like I mentioned earlier, that all this specialized equipment, it is costly. And we need to be able to see how we are able to fast track primary healthcare setting. Because you can imagine areas in Botswana like, say, maybe in Gamiland or even the Kalahari areas. Some of these technologies that you are talking about, are they available so that in those areas to be able to assist the women around or the community in those areas? So there has to be prevention, there has to be diagnostics, which ultimately now says, let us put in the new treatment method that is appropriate to be able to cure Toikapa.
Okay, let's talk about prevention. How do you prevent cancer?
So, because you are talking about...
You're talking about prevention.
Yes.
And someone is listening. How do you prevent cancer?
So, we're talking about, you'll realize that in terms of the campaigns that the ministry is currently doing out there, that the private sector, the wellness days that are going on there, there's what we call screening. Screening is one of the first methods that you need to be able. You'll realize that most of the time, what we call a breast self-examination. Okay. I think this we've had it a couple of times.
Okay.
That is at home. That is in your private setting.
Yes.
Yes. Yes. That is true. Yes.
And breast cancer.
That is true. And I'm glad you are raising that because, you know, as men, we need to also be able to play a huge role here because, you know, you realize that men sometimes, they kind of neglect the women's health because they don't really want to play much role. However, this is a shared responsibility, which promotes gender equality. This is also where we're saying that we need to understand the importance of that and support for informed decisions. That is from the men's side. Okay. So now you're asking me a question that how do you get to really examine? There are methods, unfortunately, how do I really demonstrate it to you? But there are those methods which they are really taught. Even we do work with the cervical cancer program as well as the breast cancer in terms of how to really get to examine your breast so that you can be able to say, a lump that I'm not sure about. Immediately you get to pick up that. That's when you get to say, there's a lump that I've managed to fill in this particular area. What could it mean? That's where now we're saying prevention and early detection. And if now, at that particular point in time, you are able to fill that lump, it now helps the healthcare professionals in terms of saying what are the necessary methods that needs to take place.
Okay. I want us to talk about the issue of the private clinic, the private hospital, the medical aid, you name all of them. Has cancer or some of these non-communicable diseases become a cash cow for private clinics, for private hospitals? Why do I say this? I say this because they're the ones who've got high-tech equipment. They're the ones that will run to them, your private hospitals. When you're told that you have cancer, when you're told that you are diabetic at a certain level, you go there. But once your money is finished, they send you packing to go back to a government hospital where you may not necessarily see a specialist as and when you require, but you have to queue up. Has non-communicable diseases, for example, cancer, become a cash cow for private hospitals, private suppliers? Botswana ba jwang tsoma ke ba eleng gore ke bona ba na le ditsompelo tsa di dirisiwa tsa dikokelo tse di turang mo ya re ngona le bolwetse madi a hela medical aid go teano madi a go a hedile re go heditse madi mme wena bolwetse ke bo ba go tsa ya go kokelong ya marina ya go spatela sa puso o itlhobogela gone go. Why is it like that? I know maybe you may not be the right person to answer this one, but a ya no malwetse a ke kgwebo e tona mo dipateleng tse di ikemetseng le bao ba ikemetseng gore nya motho ha sentsa madi a go a bohelo pension a go a bohelo loaning yana go a bohelo a tle le masika ba contribute a tshwere ke kankere be re mo treater ha madi a la sona na hela ga rena nako le botshelo ba gago re mo posetsa ko sepateleng sa puso ko ene gore o fola line ya nong ibile ha ka bona ngaka kana kwa e batlang o fola hela ka mongwe le mongwe first come first serve.
Okay, thank you for that question. You see, WHO has indicated that, you see, for the public sector, in order to be able to achieve what we call universal health coverage, it needs the role of the private sector. So the first thing is that there needs to be an understanding that there is the role that the private sector needs to be able to provide and assist the public sector to achieve universal health coverage. So that one, I believe now it says we need each other in this. And the next question now would be, how do you integrate the private sector? There are quite numerous ways in which you could be able to integrate the private sector to be able to help, because we cannot leave this burden alone to the public sector. I hear you saying that molwetsi abatsewa abusetswa ko spateleng sa madi a hedile. You realize that some of the new innovative technology that is available out there, I will give, me coming from the private sector, I could give typical examples. We're currently working with the Ministry of Health to enroll what we call HPV DNA test for cervical cancer. There are instruments or machines that currently we have installed, Marina, Botswana, Harvard, as well as also in Franciscan right now. Okay. It can be able to help you detect cervical
so
cancer.
You are working, you've clubbed efforts with the ministry, with government as a private entity.
As a private entity.
I know another private entity. It's a firm that diagnoses.
Yes.
I have a colleague of mine here. I didn't mention him by name. But he's a gentleman. In November, he was telling me, I'm from there. Where are you from? I go to testa kankiri. Yaborre.
Yes. Prostate cancer.
Prostate cancer.
Yes.
That firm.
Yes.
Yes. In a particular month, in a year, end of the year.
That is in November.
Yeah, in November.
And you also partner with them. They are one of the people's stakeholders.
Let's mention that.
Yes, it's Diagnostic. I mean, Diagnostic is one of those stakeholders that we collaborate with, especially in November. The cancer you're talking about, we do that screening also. Oh, by the way, let me also say this. It's also done on the machine that we support. So we're not only delivering testing efficiency, we're also delivering greater medical value, because what the clinicians need here is better informed decisions to say, like on Botsa, when do you really get to cap this? Another one that I also wanted to mention to you, it's in terms of capacity strengthening. This is where now we see we are also training. Last year, if I were to mention to you, we've trained well over 100 healthcare professionals across different disease spectrum in terms of what are the available technologies, how to better also be able to optimize the limited instruments, the limited consumables, machines that they currently have. So also capacity. The third one also could also be in terms of public health initiatives. Okay. These campaigns that are always ongoing. Remember I mentioned earlier that prevention is very key.
It's better than cure.
You need to focus on, and with the more you get to work on prevention and screen earlier, it gives you those chances that you are able to intervene less costly. Less costly. When we catch it at stage 3, stage 4, you can now imagine in terms of the amount of money that would be required.
Bokhaitsedi a rona mo lehatsheng la Botswana re bue ka lehatshe la Botswana se le se itemogetseng le ba Orthosurge le ba botsogo kankere ya molomo wa popelo kankere ya lebele ya madingwaga tse di hakae mo go bokhaitsedi yake a ke ba sentse ba le mo bonyaneng jwa bone le banana a ke ba hagare a ke ba seng ba godile a ke ba golwane. And ha re bua ka one kankere ya molomo wa popelo kankere ya lebele e keketse go le kae mo lehatsheng la Botswana, mme bile gongwe e connectelle ka gore bokhaitsedi a rona ba dira jang nako e santse le teng go ithibela gore e se ka tla gotlhelele.
So what we have noted in the healthcare space is that, you know, just like even maybe say hypertension, back then we used to say, "Ki malwetse a o lebo 40, 35. You know, this is hypertension, this is bolwetse jwa sukiri. Now, when it comes to also now cervical cancer, when it comes to breast cancer, that is why now we're saying that from ages of above 15, there needs to be now intervention, there needs to be screening, because this is the trend that we have picked up, that we are able to detect a lot of various diseases from the ages of 15. So talking about cancer there now, we're saying that starting from the ages of 15, we need to be able to intervene. And you also mentioning in terms of how we can be able to advise. You see this public health initiatives in terms of screening, the wellness days that are always going on.
Tuto.
Free of charge. It's happening tomorrow, or maybe it's in another mall there. You can basically get to know your blood glucose measurement, sukiri, your BP. Now you get there, you're told, meeting the healthcare professional, they are able to advise you, or that lamp, please go to this particular facility to be able to see how you can be able to follow which kind of method. Not only that, we are also saying that in terms of also the outcomes, we need to have more of advocacy. Bomme needs to be able to participate in terms of the policies and the programs that shape what needs to be done. That's where the advocacy also play a crucial role.
Mr. Tipe. Ke tipe wa go khatleng a kere
Wa go Mathuru ka.
o maturu kwa ya go ka mokhatla o bina khabo a ga e boka khabo te ka re ga e boka o ka nna khwatha gona ka bo ba e boka te o bina khabo e rileng a re riana a re bua ka bo khaitsedi ya rona bo mma rona bo bana ba rona bo monna rona ba ba go magae ba ba sena di medical aid a kere.
Yes.
Ka re ba ba di medical aid bona ba khona gore ba itse gore go mmolo mmongwe gona le di testing yana tse o ka di dirang o ka go private hospital wa swipe ba ba sa khone go swipe ba motho a le ko dom chochena motho a le ko paraka rungu a le ko bere ko nojani ko struzindam ko khawa jalo.
Yes.
Re ba thusa ya nra ka gore le bone ba kokonelwa e mebile o itlhela bona e bile motho go itlhobo go hela ya nong go e bile be re tsere nya gore ba moloile ke boloi re se re belaela gore le yona kankere ke boloi malatsi ya gompieno.
So that's why I guess you are talking about issues of how do we really get to, you know, in terms of affordability. Obviously you realize that
And outreach
and you realize that most of the time what we have learned from HIV, we can adopt the same model. I think you'll remember back then, developing in terms of the campaigns they would do from each and every village. Kiko Kawa, maybe it's Kawa,
June challenge.
June challenge. Honale that particular Tante Hakuninye, they are offering health services. But most of people, you realize they don't get to get there. So there's a lot of awareness that is required for people whenever we are having these outreach programs, whenever we are having these mobile clinics that are moving from each and every village. And as Orthosurge Botswana again also, we still do partner. I will give a typical example. This previous weekend, I think we're in Motshegare participating in a wellness day across different hypertension, diabetes. We were working in collaboration with also the public sector.
Ke tanki hela. Re Gideon Tipe, Orthosurge Sales Director. Me 30 seconds hela gore molaetso a bo hello garele kankere e mo bokgaitsedi ya rona bo mmarona bo monna rona bana ba rona bo ntsala rona kankere mo go bomme molaetso a bo hello gore ke kganye engwe molampeng.
What I would say I am glad of is obviously what the ministry is trying to do in terms of enrolling like a HPV, which will really play a huge role in terms of assisting us like a cervical cancer.
HPV, test the HPV DNA.
I think you might be used to always maybe pap smear. I think if you had to remember during COVID, ne go te gore dira PCR.
So
So this is PCR now for cervical cancer, and you get to know your results. So what would be interesting now is that in your private setting, we are able to give you a swab. Yes, and ole reputego here, even encouraging and supporting women. From there, you put it more bottle collect and you are able to now give it to the healthcare. Unlike back then, which I believe most of the people are so used to pap smear. So this test would complement the current pap smear that is used, because you realize that a lot of bone marrow sometimes.
That test they HPV DNA. How do you say lo lo ba lo kola peng hello botsa o botsa mo lo botlo go bona la ba botsogo ha ba testa ba khona bona ra gona le matlhase di ka nkere ona mo lo mo go pela 100%.
3 to 5 days, depending on which lab setup you would have taken. 3 to 5 days, and I believe you know that pap smear most of the time you realize bone marrow are waiting for several months to get the results. 3 to 5 days you can be able.
Ya no o ka dira test yone la go sna ditlhabi dipe a kere la o sa o ka dira anytime la go sna bokwa bope.
Screening is the key word here. Prevention is the key word here across all diseases. When do you get to screen? When do you get to detect? The moment you get to notice any lump, any kind of disorder that you are not used to, let's intervene.
You don't tip it. Wa beran le rona kunkuru a botsogo modimo a go keletse.
Ke a leboga. Thank you so much.
Ready?
It's true that the Pan-African Parliament, which was started in 2004, has gone through, some people may call it turbulence, but we call it